Alright, so what we're doing now is we're looking at the trunk. First we start looking at the spinal column. The top section, the first 7 vertebrae, are a cervical spine. Then the next 12 vertebrae, which is where the ribs attached to, is the thoracic spine. And at the bottom we have 5 vertebrae that constitute the lumbar spine. And on the very bottom we have fused vertebrae together. They make up the sacrum. When we go further we have the coccyx, which is even more small fused vertebrae together. When we look on the side, in the neck area, we have a curve that's this way. We call that the lordosis. It's a concave curve. So when we look from the back, it's like we're walking into a cave. And then the next curve in the thoracic spine is a kyphosis. It's the opposite. That's also known as a convex curve. And then on the bottom, we have a lordosis again, concave curve. And the very last curve, although that's fused, sort of the sacrum, is another kyphosis. When we are made in the womb, in the baby, in the mommy's belly, we're coming out like that. So the kyphoses are also known as primary curves, and the lordoses, the first one happens in the neck when the baby starts holding up the head, and then the second one happens in the lower back when the baby starts walking. Alright, when we look at the generic sort of vertebra, although this is a lumbar vertebral segment, but generically speaking, the vertebrae, most of them have features that repeat themselves. One of them is the large space here. That's the body of the vertebra, also known as the centrum. And then we have this, when we hold the vertebra this way, we can see like there's like an arch that is being made. That's known as the vertebral arch. The bottom portion of this arch right here and here on both sides, these areas are known as the pedicles. They're like pillars that come out. Then we have a fairly large area that's actually this big on this vertebra, that's made up from the inferior and the superior articular processes, having the inferior, this round thing here, and the superior, round here, facets. Those make joints with adjacent vertebrae. We look at these things sticking out on the side. We call these the transverse processes. Like processes are a lot. Attachment sites for bones, for muscles. And then when we go further posterior, we have a little bit of a lamina. That's called a lamina, that comes together and joins in a spinous process. So the tip at the back is the spinous process. So wherever you touch, when you touch yourself in the back and you feel those bumps are spinous processes that you see or you feel. The hole that is created by the vertebral arch is known as the vertebral foramen. So now let's go to the very top of the spine. The first vertebra looks like this. So this is not really a generically looking vertebra because what do we have missing? We have no body. It's a no body. Its name is Atlas because this is the vertebra that holds our head up, like the Atlas in Greek mythology holding the head up. So right in here, these areas here is where the occipital condyles sit. And these are, of course, the ones on the occipital bone of the skull. We have the superior facets, and on the underside we have inferior facets. And we just, in the C1 vertebra, we call these areas the lateral masses. And then what we do in this class fairly easily, we have an arch that's in the front. It's called the anterior arch and the posterior arch. And then we got, on the transverse process area, we've got these holes coming in here. And these holes go from C1 through C6. And those are known as the transverse foramen. And this is where the vertebral artery comes through. So that's all we worry about the C1 for right now. The second vertebra sits right underneath the C1, and that's known as the C2. We also know that as the axis because it has these things sticking up here, and that's known as the dens, but that makes that vertebra sort of an axis that C1 can rotate around, like that. So that's why we call it the axis. As a matter of fact, half of the motion of the no motion of the neck comes out of C1 and C2. So that little bump here that sticks up is known as the odontoid process or the dens. And if we look and bring both together again, in the old days, long time ago, you can see how the odontoid process could have been the body of C1. We have a couple of features that are specific with the cervical spine. One of them is the transverse foramen that we've already mentioned. And then in the back, it's a little bit hard to see on this specimen, but the spinous process bifurcates, which means it goes into two, it splits into two. The uncinate process, in the uncinate process, you can see a ridge that rises on either side laterally to the body, and that's known as the uncinate process. The facets joints in the spine, in the cervical spine, are mostly oriented in this plane and are flat. And that's a thoracic vertebra. Something that we can pick up right away in a thoracic vertebra is it is bigger. And then the other thing that we can see quite nicely is the spinous process is pointing down and is quite long. And then we got some other features here, and those are costal demifacets on the vertebral bodies, as well as a transverse costal facet or transverse process costal facet. Here you can kind of see, this is a real one, so it's a little bit deteriorated, but you can see an indentation here and one right here. And these are the costal demifacets. As the rib comes in, costal means ribs, as the ribs comes in into the body, every rib for the first 10 ribs attaches to the body below and the body, vertebral body above. So it comes in sort of like this. Okay? A vertebra from the lumbar spine, vertebra. The big feature here is its size, obviously. There is no costal facets, there is no uncinate process, there's no bifurcation, but we have a big, fat, sort of spade-like spinous process. Look at this one here. It's a spade-like spinous process, so it's quite large. And we also have quite small and tiny, and often in real specimens broken off, transverse processes. If you look at the facets, they're sort of rounded pockets. And on the underside, they're of course rounded the sacrum. This is the anterior surface of the sacrum, and the sacrum is called sacrum because it's a sacred bone. So these are known as the transverse ridges. They are remnants of intervertebral discs. Fused spinous processes are known as the median sacral crest, and where the transverse processes were, we know that as the lateral sacral crest. The bottom of the sacrum, the inferior portion, is pointy, so we call that the apex. The top is more wide and broad, we call that the base. Where the last disc comes up, which is L5 here, and then S1 starts right here, the sacrum. The front portion of that is known as the sacral promontory. The outside, right next to the first sacral segments that create sort of the base, they're looking kind of like wings, and so we call them the ala of the sacrum. And on this specimen we can see nicely a C-shaped sort of flat joint surface. This is a joint surface that will make the sacroiliac joint, sacrum to ilium, and that is known as the auricular surface.